all cap.
Sorry.
To identify your region of Contra Costa and how long you've been in Woodbury.
All right, so I'll start with the roll call. Rena Moore,
Here.
Rena Hurley. Not here, and then. Sorry, can't find my.
Latonya.
Yeah, Latanya.
Here.
Perfect. We have quorum.
Thank you. And then I'm gonna have Nicole introduce yourself.
Yes, my name is Nicole Green. I am the vice chair for excuse me, I'm talking more for CAP, and I am here in seat of our chair, Ozzy.
Thank you. And then I'm going to have introduction of staff and county agencies.
Hi, Patrice Giller here from Office of Reentry and Justice.
Hi, Michelle Elizondo, Program Coordinator, Office of Reentry and Justice.
Kimberly Aseo, Office of Reentry and Justice.
Jenna Evans, Office of Education.
Thank you. And then we'll have the agencies introduce themselves.
Yolanda Hughes, Loud Family.
Thank you. So prior to moving to announcements, let's set the table for decor in this room. Persons who wish to address the community advisory board doing public comments or matters within the jurisdiction of CAB that are not on the agenda or wish to comment with respect to an item on the agenda may comment in person, via Zoom, or via call-in. Those participating in person should make public comments when called upon. Those participating via Zoom should indicate they wish to speak by using the raise your hand feature in the Zoom app. Those calling in should indicate they wish to speak by pushing *9 to raise your hand and then *6 to mute and then unmute their phone. As a courtesy to others, public comments will be limited to 2 minutes per person. Let's pause for a moment and review our purpose. The purpose is to advance justice, reinvestment, and protect community investments. Some of our responsibilities are recommend programs-related policies around both existing and new funding opportunities with a focus on evidence practice, local, regional, national, innovation, and recommendation for implementation. Engage providers to educate CAB and our committee members about their work, outcome, needs, and recommendation. Promote a structure for any implementation of a comprehensive need assessment for the county reentry population. What's working, what's needed, to inform future program recommendation, funding, allocations. We are grateful to those who are members of the committee, and we appreciate your time. Now let's continue with our agenda. Are there any announcements?
Oh, actually, I have one announcement. I just learned recently that that Impact Justice is soliciting responses to their RFP for housing, reentry housing incubator programs. I could certainly send that around to everyone, but the due date for that is July 19th. And they came and presented to CAB in the past about their homecoming projects. So it looks like they're trying to expand some of their housing.
Are there any other announcements from anyone in the room? Being that, I'm going to ask if there are any announcement for those that are attending via Zoom. Okay. So, and there's no public comments either. So
No comments.
We're going to move on for the approval of the minutes. If you can bring that up for us, if we can review them.
Okay, this is Rena Moore. I call for a motion to approve the minutes from the May 16th, have programs and services subcommittee.
And this is Latanya, I second the motion. So Kimmy?
Perfect. All in favor, say aye.
Aye.
Perfect, it passes. Thank you.
Thank you. So next on the agenda is to discuss updates on future in custody surveys, and that's page, attachment 2, pages 7 through 8.
Yeah, so I can give an update here. We had an opportunity to connect with Jody Sickenier from the sheriff's office about was a request to circulate the survey again, but this time specifically targeting the women's module. And just to receive feedback of the best route to do so, she recommended, I think there was some conversation about whether to do both the paper copy as well as the tablet. She recommended doing the tablet only, and reason being is that you want to pick one method to control for multiple responses from the same person. It appears that that's not very difficult to do in terms of having the survey added to the tablet. So I think in terms of next steps, they would the sheriff's office would the questions again. And then after that, they would add it to the tablet. We can let them know the time frame of which we'd like to receive a collection of those responses, and then kind of go from there in terms of how we prepare the now whether whether the outcome of the survey responses are going to automatically be kind of analyzed through that survey platform that they have on the tablet, or if our office needs to take that raw information and do the analysis, that's going to dictate the amount of time it takes to come back to you guys. But otherwise, it sounds like just at least distributing it, getting it out on the tablets is going to be heavy lift to do.
Okay. Are there any questions about what we shared? And then on page 7 and 8, this is an actual survey that will go out on the tablets.
Minus the question, the open-ended questions. So all of the multiple choice and questions, those could be included. I think you guys decided last time that all of the open-ended that will require a written response to go ahead and take those off. So that would be like 10 through 14 or whatever.
Yeah, because there's no way we can make those an open-ended question. So the ones that will be on the survey will be 1 through 9 will be the ones that go on the survey for the tablets. Are there any questions about the survey, the process, or anything that we discussed in regards to the in-custody survey?
I have a question. So, y'all have emailed us these questions, right, and asked for a response back. So we'll have to look at a response back. But, with the open-ended questions, I kind of.
Well, the open-ended question, you say you tweaked it, but it was still going to be an open-ended question.
Right, I gave my goal responses for that for suggestions.
Or to make it into a multiple choice?
Yeah.
Okay, I wasn't aware of that. So we can bring that back if you guys want to look at that together. To see that.
I mean, like, we use a lot of time too, so I don't want to build it up either, so. Maybe we could do that for next year, sorry, for 1 year. I mean, it's a 1 year.
Okay.
You know, call.
We also
I-
have a question online. Yeah.
I'm sorry, Kimmy. Hi, Kimmy. Sorry. I think Raina just addressed the question because I believe what I heard you guys say is 1 through 9, and I was just gonna ask and not ask, but just give feedback that 10 through 14 seemed very important, and if there was a way to still include them, but in that format. So I think I could only hear her a little bit, but I think you guys just said that you will go and try to make these into questions that can be uploaded. If I'm wrong, just correct me.
So Rena indicated that she had responded via email within the time allotted for us with suggestions on how to make questions 10 through 14, where it was multiple choice.
Okay,
They could just select it. That information wasn't updated on the form. And, Ariana's not here today to chime in to say, you know, if she was able to review it or why it wasn't updated on this.
But what we could do then, is again offline, and over email is take those edits, update it even more, share with you guys, get your okay on it, and then send that over to the shares, because they have to review as well. They probably will have their own.
If we could do that, because then I would make sure that every board commits to responding within 24 hours, so that we don't prolong it on our end, that you can report on your.
Okay.
And then Kimmy, you were getting ready to say something. I'm not sure if there's someone that called in that we're not able to.
Oh, no, I was alerting to Nicole. I wasn't sure if you guys saw her, but I think you saw her when I did so.
Thank you. So are there any other questions in regards to the in-custody survey or process, the next step before we move on with the agenda? Okay. Next on the agenda is discuss review CBO presentations. That's going to be attachment 3, pages 9 through 46.
Yeah, so the ones we included here, these are all the CBO presentations that you all, where you heard presentations directly from the programs last year. So we're bringing these back so that way you can study and review, and that may help with your conversation around certain questions you want to ask and or how you want to conduct meeting with the different programs. There are a lot, you know, it was 7 programs. So just for the sake of not overwhelming you with so much information, we included in today's packet, the Reentry Success Center, the Reentry Network, and Bay Area Legal Aid. Or possibly the next meeting, we can include then some of the others. So that way you can take them one by one and decide what your relevant questions would be for the program.
Okay.
And because the questions that's fair, we would be like the questions we have covered.
Right, because they're all, you know, so each of these programs, it's probably best not to, you're going to be comparing apples to oranges because each of them are providing a service within a specific service area that the other program may or may not do, right? Now, the center and network are somewhat similar in terms of what their objectives are, but even how they implement their program model is different, right? One is a physical location, whereas the other one is more field-based with staff that go out to the community. So, but I would say those two are probably more closely aligned compared to the others.
Okay. So we have a 3. I had kind of jotted down some questions. You want to start with? I guess we should start with order. Of the Reentry Success Center, which was Pat Mims and Tiffany that presented. So they talked about the Reentry Success Center, service coordination, building community, new members, the budgets, their staff. And then I'm just kind of going through there and then we can come up with some questions. Again, I think there's some general questions that we may be able to use for what they do.
I have a question for all service providers, like, which sure that they can write house.
Nicole has her hand raised online.
I was just gonna ask if y'all can speak up a little bit because I can't hear you on Zoom. Please, I appreciate you.
Oh. Is that better, Nicole? Okay, so I was spoken to, so it could be. Nicole, can you hear me now, Nicole? You're muted.
I can hear you.
Okay, my bad, sorry about that.
Thank you. You're getting like me. We start talking and then we stop. Thank you.
So we could start with like basic questions, like verifying that they actually visit all three locations in Contra Costa. So ask them, which facilities in Contra Costa they visit.
So for the Success Center, when I'll say not just for Success Center, any program that is, contracted to serve countywide, it just simply means that they are serving an individual irrespective of where they live in the county. So they may not necessarily go, when you say go visit
The three locations,
are you talking 3 jails?
Yes.
Oh, okay. Okay, I wasn't sure what you were
Okay.
talking about, 3, yeah.
Okay, so I can ask, do they, which of the three locations do you visit or go into? That question on everybody, providers, because not everybody goes to the jail.
Yeah, I'm not,
Tiffany goes in the jail, doesn't she?
I don't know, she specifically goes into the jails and maybe, Jana or Nicole based on, GPS, because I know sometimes you guys coordinate, visits with some of the programs, but I'm not sure which staff specifically from their program goes in it, but I know they go.
Okay.
Looks like Nicole
Oh.
might.
I was actually resay your question, but I'll let Janet answer the GPS question. I had a whole different question.
Okay.
Yeah, so as far as who's coming in, that we know of for sure to meet with folks, on the RFC team, I've seen Alyssa in here, I've seen Brianna in here. I'm not sure, it might be the same for Marsh Creek, because I heard Brianna say one day she was gonna go out to Marsh Creek. And occasionally Tiffany has been in here.
Okay, you said Alyssa, right?
Yeah.
Okay.
Yes. And Ebony sends in all of their inReach letters on a monthly basis to people who have release dates.
Okay.
Go ahead, Nicole.
No, I'm just gonna say, I think it's that the question that you're asking is great, and it may be, I would probably still ask them to reconfirm because I know it changes depending on staffing. So it really just depends on who they have available to go out. I don't know. I know, like Jana said, I know Ebony's the one that's responsible for the letters, but in reference to sites, especially in Marsh Creek, what I experienced, it just depends on who's there. So I know at RSC, others depends on who's cleared are available to go in. West County, they're able to go there more, but when it comes to Martinez and Marsh Creek, it really depends on what staff is available at that time to be able to travel to those sites. Health Right 360 travels more they're here on Tuesdays. Men and Women of Purpose are here on Mondays. And then when it comes to Center Force, Marsh Creek and MDF, they come in and out as requested.
Okay, and I know Men and Women Purpose goes in on Mondays, to facilitate a class, but I know that they go in during the week and actually meet with people one-on-one.
I know, well, at Marsh Creek, it depends on the need. They haven't yet, so it's been more structured around. Yeah, it's been more structured around, I'm sorry, they're meeting on Monday. So from a GPS perspective, if there's someone that I know that is working with them, I'll send them up to their workshop.
Okay. So we have Men and Women Purpose, we have, Health Right 360,
Center Force,
Center Force, those are the three.
Laos.
Okay, those are the 4 we know that are going into the facilities, correct, Nicole?
In reference to, yes, so there's the RCBOs, that's correct.
Okay. And for the other ones, are they not going in, or we're not sure if they're going in or which ones they're going into?
Which other ones? I'm sorry, go ahead, Jenna.
Area legal aid and,
Yeah, Barry Legal Aid comes in.
Mm-hmm.
and then Rubicon.
Mm-hmm.
The WIOA, yeah, part of Rubicon comes in.
East County does. West County has not selected anyone yet because we use RC. So RC does all the referrals to the Richmond Rubicon staff. But for East and Central, it's WIOA staff as well as yes, the WIOA and a reentry individual from Rubicon comes in to facilitate.
Okay. And then is it, I guess the next question we want to ask is like, how often they're visiting. So I know that, again, some of them may go in more than one because they do more than one thing. To make sure that, and then like, who are they seeing? Because I know that, one, I can't think of her name. She goes in and she deals with sober, clean and sober. So I don't know when she goes in, if she's only seeing those people that need to utilize her service. Nicole?
So I apologize. I'm just trying to catch up because I joined and let y'all do y'all stuff. I'm just trying to tie into the question regarding in custody into our recommendations. Like where does it so with this information, and it just educated me. I'm not saying it's wrong. I just so I can understand what we're looking at and be able to respond with the proper answer. Ask them about the in custody part. What data are we trying to get from that?
Ask who?
The providers about how often they come in, when they come in, what is our goal, objective from getting that information. And that'll help me when I'm structuring recommendations too from the policy and budget standpoint. So what when we get that by asking these questions, what is our objective? What is our end goal with that information?
One, to find out what services are being provided inside of there, right?
Okay.
And if services are different than the ones that are doing post-release. And then who are the services being provided to? So when they go in there, are they servicing everyone, their population, or a specific need in regards to, again, if it's for clean and sober, she may not see all women, she may only see those that have identified that they need this resource.
Are you referring to Annette?
Yes, Annette.
Yeah, so she meets with, at this point, she's meeting with every female in custody to determine if they want to work with her and or want to be referred to this center because they're returning to the other part of the county.
So she works with everyone in custody, but when they're released, she'll only work with East County and Central, because I believe.
East and Central, yeah, because that's what her contract is for.
Now, do we know that if someone needs clean and sober and they are a woman, do we have a resource for West County?
And yes, they have, so there's two individuals that help people. It's, Annette, and then there's Anthony. When it comes to West County Center Forces, sometimes we have Anthony work with those individuals. So even though they're in West County, they still will get support.
Okay, and Anthony works with both male and females?
Correct. But his main focus really is for West and parenting, but he has worked with some of the women before. Yes. But Annette initially is hired for that. And I know, go ahead.
The RSC staff does support the women leaving
Mhm.
here who need services in West County,
So
even if it's SUD or not.
So I know she collaborates with them and sits at their office. So Lynette doesn't have like one space she sits. She, like Jenna just said, to piggyback, she works with all of our partners. So if there is someone coming from West, she will then coordinate and work with like Tiffany and them. So anyone that's working with her, she will work with them to kind of figure out where's the next step when they get out. So there isn't really a gap of I can't help you. She also works with Laos and West, whoever the case may be, in order to connect that the woman that's being released the proper services.
Okay, so in service, Annette helps all, the whole woman population. When it comes to being released, she would then work with Anthony, Tiffany, and other agencies to ensure that they get the help and support they need on the outside.
Unless they're going to Central and East and they're
Correct.
actually on her caseload.
Correct.
Okay. So Anthony and Tiffany are the resources we have for West County for the women?
I was under the impression Anthony was only doing East County, but.
Well, he does parenting for East, but he does come over to West.
Okay.
So I mean, in a nutshell, the Center First program is there to support women that are in custody for pre and post release services. So just like with any caseload, when they get out, it depending on that caseload, Cynthia will look at that and assign it to who it needs to be assigned, to, if it's Anthony and or Annette. But Anthony does help people in West County.
I have a question to, just read it again. So my question is, so based on what I've heard, right, maybe I'm tripping around, but so people in custody are getting information about Wyola and from all these different service providers too? I was aware.
Yeah,
Mhm.
and then also through, Office of it, because there's adult schools.
Yeah.
So now keep in mind, there are these programs that are being provided in custody, but nothing that's required of anyone. So when you say, well, they're serving all the women in the module, no, they're serving anyone in the module that wants to get connected or get referred into any resource. And that's the case across any of the three facilities, right? And then, most of these programs, they're in jail or in custody service or support is that they go and connect with folks prior to them being released to get them ready, right, for engagement resources when they're released. But then that's separate from them, what are the in custody programs that are happening while they're there. And again, I'm sure really should be having Jody from the sheriff's office to speak to what are all the in custody programs that are available. And so we could have that set up for another time. But certainly, sorry, I don't mean to Nicole and Jenna keep putting you guys on the spot, but because you're you coordinate with the in custody programs, you know better how that flow goes.
Because you know, different now compared to when I was frustrated. That's why.
Well, what year was that?
2010, or?
Oh, yeah, we come a long way, honey, since 2010. We come a long way.
So again, Nicole, to answer your question, the purpose of the questions is just to find out who's going in there, how often they're going in there, what service they are providing, if it's like, so that we have an understanding what's being offered in custody versus out custody. That's the purpose of knowing what's going on.
Yeah, so again, there's the in custody programming
Mhm.
that's overseen by sheriff's office.
Right.
So that would be, that's one thing.
Uh-huh.
Then you have pre-release, which that planning is taking place with Office of Ed, right? GPS, so we got Jen in the post, we can speak to that. Then there's the post-release services, all of the AB 109 community programs, which you'll be reviewing on those presentations. All of them, if staff has clearance, can go and meet with individuals prior to them being released. So are they delivering a specific in-custody program? Not necessarily. The only one that will probably be closest to providing an in-custody program would probably be Center Force through their gender responsive case management. I'm assuming some case management might be taking place while the person is in custody, potentially. So that's the distinction there. So you kind of see it in that sort of view, then you can kind of get a sense that those are the programs that are funded for AB 109 in the community. That's what their purpose is for, is to provide post-release supportive services. But that doesn't preclude them from interacting with folks prior to them being released, right? To get them prepared and ready and connected essentially to the services once they get released.
Okay, so we have in custody, pre-release, and then post-release.
Yes.
Okay, and the only one that would touch on basically in custody would be Center Force because.
Potentially, yes.
Okay.
Now, well, then I gotta take that back, because in their groups, right? Jen and Nicole, there are groups that some, like the center and the network, I think are running groups or were running groups at one time. At Marsh Creek Detention Facility, I don't know if there's any others.
Yeah, Health Right is doing groups through the sheriff's office at Marsh Creek, and then Men and Women of Purpose is doing groups at all 3 facilities through the sheriff's office. And then, of course, they have their AANA and a bunch of other things, but Jody oversees all that.
So, is it okay for us to ask a question to each agency, since all agencies goes in there, just for them to clarify if it's individually, a group, if they're actually offering like classes that result in a certificate or success of completion while they're in there, because a lot of them are talking about like they're taking the classes, so it may be a 6-week class or an 8-week class, and then what does it focus on? So it may talk about clean and sober, it may talk about, maybe they have parenting class or anything, just so we have an idea of what's actually being taught, focused on preparing them from the outside.
So I would say the best route to go is to have a presentation by the sheriff's office about all of the in-custody programs that are made available. Because any programming that's gonna happen while in custody has to be approved by the sheriff's office. Nobody's just gonna willy-nilly go in there and start a class.
Right.
So that's not gonna happen. So at least from the, you would have all of the programs that are, being provided, and these will include, mind you, county agencies and other programs that are not funded through through the AB 109 community programs. But at least you would get a sense of what are all of the resources that are available while someone's in custody.
Nicole?
I was going to actually say exactly what Patricia said and then refer back to the presentation that Jana did. She did one in both of our workshops for policy and budget where they gave a overview of the adult school program that included all the classes as well as game plan for success. So I think it'll be great to get that information from the sheriffs as well as Jana from GPS, because like Patrice said, Jody covers all of inmate services, and then she connects a lot of individuals over to Game Plan for Success for some things. And so Jana can provide that information regarding, and I know they gave a thorough presentation which outlined all the classes, because there's some things that you hit on about certificates or parenting. There are a lot of things that take place in custody right now. And it's through both sides. So that would be the best place to start off with that information, because like Patrice said, it's going to include CBOs and some partners that are not getting funding. So I would definitely say take a look at that too.
Okay. So then we want to just focus then on what they do post-release then. Is that the easiest way to approach this? Have the sheriff department do their process for when they are in custody and pre-release, and then have the agency deal with post-release since it crosses over?
Yeah, and I guess this kind of goes back to, I think, Nicole's one of her earlier questions of, it just all depends on what's your,
Intended goal?
Yeah, what's your intended goal for it to, so in gathering this and interacting with the different CBO providers, what is it that you're hoping to learn? That's going to dictate the set of questions that you want to then ask them, or how you want to engage with them. And so, we provide the presentations that were shared last year, which kind of gives you a general overview of the program that they're providing and how they're administering it. And so beyond what's offered, then what more information do you need, again, for what purpose? What is it you're trying to understand?
Understanding actually what is being provided. So when we talk about a mentor or a coach, like coach covers a whole lot, it's broad, right? So what are you coaching on? Is there a program? Is there a duration? Like, what are you working on? Are we dealing with mindset? Are we dealing with sleep? Are we dealing with the other stuff, right? Because one of the things that we saw when we did the presentation is that, we're not, that they're in jail because they've committed a crime and then they're outside and there's these agencies. But we're so focused on what they did, we're not looking at the why, right? And so looking at, are we dealing with the mindset? Are we dealing with their beliefs? Are we dealing with cognitive behavior, right? And so I'm trying to figure out like the resources that we offer. I know that we spoke, and it may have been you and I, or it could have been Tiffany, where he talks about like they have someone that does the resume. They have someone that coaches them, things of that nature, right? But having an ideal, like, and we know that when it's a mental health, that they hand them over until that is actually under control, or substance abuse. But like, really having a clear idea, what does it look like and what's being offered?
Okay, so that's why you want to go through each of the presentations. Because I think the presentations give you a foundation of basically what they offer. And then you ask the question of, okay, like for example, you just mentioned, is this offered in-house or if it's referred out? And then what it being referred out, what does that look like? Those kind of things. So I think you start with what is described for you per program, because each program is different. Not every program is going to have a cognitive behavioral intervention because it may not fit or it may not be necessary for the program model that they have. But does that mean it's not being offered at all? No, that may not be the case. It may be offered through a different agency.
Right, and that's what we're.
So like if it's, for example, Rubicon, I'm just using them as an example. Rubicon may not have a cognitive behavioral, but Health Right 360 is offering it. So is the goal to see where the work is happening, or is it, do you want to know, are all programs doing these same things?
No, where the work is being done, if it overlaps, if they're doing the work in one area of Contra Costa, but not another area, if they're focusing on one population and not the other population, and then making sure that the needs based off of the surveys are being met, right? When we have other people come out to present, it's like, well, how do we know if there's a need if we're not clear on what's being done and who is being provided to? So that's all the information is for, is to just say, what do we have, right? When is it being offered and who is it being offered to?
Yeah, so that's why I say, yeah, you will want to go through each presentation. You want to go through each program to see what it is that what they have presented as their service offering. And then from there, if you still have more questions, then those will be the questions you ask.
Right, because I did meet with, I met with Cynthia outside of the presentation. And when we met, the focus was on really the men. And then it was later discussed that, oh, we can offer to the ladies, that wasn't originally discussed. Right?
Yeah. Well, I don't, yeah, it depends on your conversation. Yeah.
Okay. So do we need, so we can just go over this and then come up with our questions. Our questions.
I think that's the best way to
Right, so
go.
the questions are basically, what do you offer in service versus out service?
Because if you try to ask the same question across all programs, if that particular question may not
We can
fit,
probably-
but it may not
Right.
be relevant to their particular service offering.
Because I didn't know Bay Area Legal went in there, and then there are times where people may have like a low income and they're trying to figure out, can they keep their house or whatever's going on. So it'd be nice to know what services they offer, for those that are incarcerated versus those that are out.
So again,
Right.
whatever they offer, their connection while they're in custody is to prepare them, get connected to them, because they're expecting that this person's going to be released, and they continue working with them while they're in the community.
Right. Okay. Okay. Is there any questions, concerns about anything we discussed? So basically what we're gonna do is we're gonna look over the presentation. Each person will go over once that they're visiting, they will come up with their questions, to have a better understanding of what is being done, in service versus out service, who they're servicing, and things of that nature.
Yeah, so I will so if you're gonna look at the Success Center first, for example, I think there's a particular slide there that may have, I think it's a list, maybe a service offered. Right, something like that.
For the on-site
There
service.
you go, resources, what's the next one? On-site services, so there you go. So this is, so the way that the Success Center is set up, the physical location, they have staff that's available to interact with individuals that are referred to the center, who they identify, they call those clients members, right? So you're joining this center and you have access to a variety of services that are provided on site, or connection points that can be made on site. And so this is what they have. So Contra Costa County Behavioral Health and AODS. So this, I do know that they have office hours set up with AODS, that's our county drug division, drug and alcohol division. They're drug counselors. So it's county staff that has office hours at the Success Center. And they're available to meet with any of the members, right? Any of the referred clients that go to the Success Center. So is it a referred service? Technically, but it's provided, staff is there in the center, available for any of the members that want to have access to that drug counselor.
Right, so on this one where it has like on-site services. So would we even discuss Bay Area Legal or just deal with Bay Area Legal directly?
This has to do with your question. Okay, your question is, you wanted to know, what does each program offer? Right? And to offer, where are they offering it? Where are the various locations that they're offering? What is it that they're offering? And I think you qualify. Are they referred out, or is how someone getting connected to these resources that they're offering? So Success Center is saying that these are all of the services, these are all the organizations that come to their site to work directly with clients. That includes AODS, Bay Area Legal Aid, Public Defender's Office, even Rubicon. Rubicon's employment liaison coach, whatever the case may be, can come to the actual Reentry Success Center site and work directly with the client there. Healthcare for homeless, that's also through, our health services department. They're basically like a mobile team providing primary medical care for the homeless population. The reentry health conductors. Now, those are the folks who, they're also through our health services department. They specifically work with folks who are formerly incarcerated. They can get them hooked up with Medi-Cal benefits, and also seeing a physician at off hours. So like 5 to 7, something like that, outside of the normal like health clinic hours. So they're able to come on site and work with folks there. Employment related services, this must be something related to what their actual coaches, their staff. So the Reentry Success Center staff might be doing here, helping them with application, updating their resume, whatever the case may be. Center Force, this is I think what Nicole and Jana was speaking about earlier, that they are also able to work with folks out in West County, so they're coming to the Success Center to do so. And then their own coaching, and then here, the cognitive behavioral work. They are providing a cognitive behavioral program. This is their Thinking for Change program that's available both for, I believe, both for men and women, or at one point women was put on pause, maybe restarted. So this is all happening at the site.
Okay, so we will get clarification on which ones they're actually providing the service and which ones they're referring out to someone else, even if the agencies come into their location to provide the service, such as Bay Area or Center Force.
So all of these would technically be, you're considering, with the exception of the cognitive behavioral program and coaching, all of them would be technically referred out. If you're trying to figure out that specific nuance, because these are all separate agencies. They're just sending their staff has established office hours at the center. As kind of like a one-stop shop, that was the whole point of it, right? The center's, model is to be a navigation center for a variety of resources that are available. And they make it convenient for clients by having staff at other agencies come to the site and work with clients while they're there.
Right, so I understand that, because it's it's a one-stop shop. Bay Area Legal's coming in there, but they're coming in there as their own identity, right? They're coming in as Bay Area Legal providing their service. It's not like they're working for
Right,
the agency,
right.
right? So basically, we still need to separate like what you actually offer, right? And then what you hold space for it to be offered here, because that's two different things.
Okay.
But we know that they do, have ownership over the comprehensive cognitive behavior program, that's theirs. Right?
Yeah, that's their program that they administer, and then they, I guess you would say coaching too, because they have engaging coaches.
Okay. So, perfect. So like, for example, for the reentry coaching, like, what does that entail? Like what they cover and what they do? It would be like one of the questions we ask, just so we have clarity on what a reentry coach is, because you're different than a life coach, you're different than a mentor. So your services would be different, just so that we understand like what they do. No. Are there any questions from anyone online? Okay, so we're gonna move on to.
So the one after this one is the, reentry network.
That's what I was gonna do, I did, so.
Yeah, so again, they're very similar to the, to the Success Center, but not that they necessarily have services that come on site because they're field-based. They connect with clients at different, service locations. And they also have subcontracted services too. So for example, they subcontract with Center Force to provide a gender responsive case management piece. So that allows them to work directly with their women clientele. Ms. Shirley's, who provides network housing. And there's also Divine House, which I believe is a SLE. But they also cover the costs of that for their network participants.
My question, when I would go there, would be like, which services offer right now, so now, like, you just clarify some of that. Because like right here on the side that says services offered, it says housing assistance, but they don't necessarily offer it, they refer out to that too, right?
It sort of, so because they subcontract, so they can refer out to, like, say, Loud Family, right? Then they also have contractual relationships with Divine House and Ms. Shirley's for housing slots for their participants. So in that case, do they administer a housing program? No, they contract with a housing provider who will do that for them. And so they're still working with the client and still on their caseload as the participant is placed in housing.
So, because of it, Synergy in East County, are they able to refer to one?
Yes, Laos countywide. But Laos program, sorry, population but Laos program definitely prioritizes those who are on AV1 probation and probation fines just in general. Whereas with the network housing situation, that's available to anyone who's actively engaged in being case managed through the network.
So they have Yeah, find out which ones these they actually do. Yeah. Versus the ones that they refer out to. And then on what page is that? Service and resources, they list the network service providers. These three right here. So they're referring us out to these agencies.
Can you scroll, can you?
It's right there.
What,
This is the service and resources, where it says network services provider, those are the three,
so that's who they subcontract with.
yes. Um, That's the other network resources right there. On the opposite side.
And so these are things that they actually provide in-house. They have a monthly workshops on, they call it the reentry bigger picture. They've done some financial literacy workshops. They created an app. They have some motivational incentives. They host a Restoring Hope and Community Resource Fair. They have their own Mentor Navigator program. And then their No Wrong Door sites, that's where they're able to have MOUs with different organizations out in Central and East County as entry points, if you will, for referrals to their network.
Okay. So these for the network resources, these are actually things that they own. They're not resourcing these out.
Correct, that's what they do. And actually, I think they had a graphic on here. Can you scroll up a slide, Kimmy? That might make that clear.
The reentry system structure.
Yeah, the reentry system structure slide. I think it's,
Oh,
yeah, there we go. So it shows you there that probation in the kind of this chart, probation will refer to the reentry network team. And then the reentry network team then has their mentor navigators that they build out, and then their network providers who they have subcontracts with. So that's kind of their realm of responsibility. They also send referrals out to the other service providers, which is why they have service provision, housing, employment, family reunification, legal services, mental health treatment, and then any other No Wrong Door sites, so CBOs or faith-based organizations that they partner with.
And they can tell us what vocational training they offer. And if they do any apprentice.
So they would refer that out. That's why there's an arrow from AB 109 service providers. They go to service provision, and it's employment/vocational training.
Right, they should be able to tell us what vocational training that they're referring out to, right?
It's because the arrow is connected to the AB 109 service providers. I'm sure it's to like our employment provider, which is Rubicon.
Okay.
Now, if they have connections like with any of the local colleges or something like that, I'm sure they have connections. Predominantly for employment, vocational training, that would likely be.
And I was only asking, because sometimes there's an apprentice program, sometimes there may be like a nursing program, so just trying to figure out, like, when you say vocational training, like, what are the actual training programs that are being offered?
So that would be a question for the employment provider.
Okay. So she said maybe we would. Yeah. And then mentor navigator, that's them to the No Wrong Door sites. They're actually being done by them.
Yes.
And then when we go to the community reinvestment grants, which I think is down a couple of slides. And we're talking about mental health. I know they do cognitive. Do they actually have someone on site? I mean, I just want our staff that does mental health, or is this being resourced out?
Yeah, so I think it says here, this is the grant. Now, this is actually, this particular program is getting ready to phase out because they didn't get another grant for this, but essentially they hired a clinician on to be on staff. And in doing so, they're able to do individual counseling sessions. That staff person ran cognitive behavioral groups for the substance use disorder treatment. They actually currently have 2 staff members, not funded under this grant, actually funded through the AB 109, that are certified drug counselors. So they were able to host some of these groups here, harm reduction circles, relapse prevention and recovery support.
Okay, so they have 2 staff members outside of this grant program.
They have 1 funded through this grant program that's providing mental health piece, and then the substance use disorder treatment is they have 2 staff members who are drug certified under the AB 109 program who were able to do this for this grant.
Okay. Now, do we know if losing this grant is going to impact the cognitive work that they do?
Likely, but it might be a follow-up question to
Okay.
ask if there's something that they, you know, are planning to offer again in the future. But this was the good thing about this was that this was something that wasn't funded, right, through their current AB 109 contract. This was an added benefit that they, were able to seek funding for this to provide and make available not only to all of the network participants, but really just folks out in the community. Because I think for this particular grant, the target population was just Contra Costa residents.
Okay. Any questions from anyone in the room? Any questions from anyone online? Yeah, Mary, yeah. Okay, so we're gonna move on to Bay Area legal.
Yeah, basically my question you asked, I wasn't aware that they went to the jails or the street. Yeah, so when I go in there, I can ask to, like what services they put, so they went to jails, they basically just connect with the clients?
Right. I'm not sure if they initiate any of this kind of work just yet. But I'm sure it's just initial rapport building, letting them know that, they'll be available to them upon release, but it's at the very least that, making that connection so that they know. So that the participant knows that they were, they may receive their referral or their letter or however they got to them, and will make themselves available to them.
When I've talked to them in the past, they've kind of mentioned like that they provide all these services, but because they're so, money and staff learning that they can't really help as many people as they want to. So that's like big issue too.
Do we know offhand who they work with to have records expunged? Or I know it's.
I'm sure they probably work with, public defender's office to do to do clean slate. I think they're also capable themselves as attorneys.
Okay.
To do all of that.
And I do know, I've referred people to them a couple of times, they have, clinic hours on Monday. They can either make appointments or first come, first serve. I think it's from like 9 to 10:30 or 11. And they'll help with like eviction and things of that nature. And both people I referred have been happy with their process, and it's only on Mondays. Do we know offhand, or would we even want to mention? I do not remember the number for those who, sex offenders. Do we know if they provide any service? Or would we even address that? And I know you work on some other stuff.
In terms of, does Bay Area Legal Aid, work with 290s?
Yeah.
I would assume for legals, for, civil legal related services, I'm sure they can. 290 registration usually becomes an issue, when it's related to housing for the most part. But many of the other services they can potentially access unless you guys are seeing something different, Nicole and Jen.
No, I was just about to say they did a presentation at Marsh Creek, and it was very exciting to hear them talk about the service that they do provide for 290. So they did. She did send me a copy of her PowerPoint that I could send over to Patrice. But they do provide the way that she explained it, I'll say navigation and like legal assistance if there's questions around like how that status may affect them in employment and in housing. Once they get released, they can help them navigate through that. So I was really excited to hear about that. So I can definitely share if that's helpful. But to answer your question, they do provide services to help individuals that are 290s.
You have any questions? Okay. Any questions from anyone on via Zoom about questions that will be asked for Bay Area Legal? No questions? So the next part is discussing updates on CBO site visit tours. Renee's not here, so I can't speak to where she is in regards to this. We had an appointment we had to reschedule with Annette. She gave me an email. She sent an email out asking me about June 25th. So basically what I'll do is I'll go back to the presentation. I believe we did her presentation in September of 2023. And if you need me to, I can submit the questions I will ask her in regards to it, but I have an idea of where I'm going, what questions I ask. Originally, we talked about what she provides while in custody. And then I now understand that when they're out of custody, that she works with Anthony and Tiffany, which answers a lot of my questions about making sure that no one falls through the cracks and they have the information. So my question would be more about the type of programs that they offer, if it's a 6-week, 8-week, if it's individual, if it is a group program. And then afterwards, once they graduate, are they still able to access and work with people? Are there any check-ins to make sure that as life happens, they've said that what research has shown that even if someone is clean, that as life happens and they become stressed or overwhelmed, they may go back to drinking or doing controlled substance to find out like what support is offered to them. So I can send my questions to you and Garyana if you guys can look over, but it's just basic questions like that. But a lot of the questions have been answered to make sure that we have those resources and that she's able to see all the ladies in jail to find out which ones need her service or would like her service, and then having a work relationship with the other two. Makes sense.
Yeah, and I think, you guys as a CAB body have really done a lot of work to analyze and understand what gaps exist in the kind of space of reentry services that are offered both between the county agencies and the CBO partners. And it's good to know that some of the conversations that you'll be having will likely reaffirm what you guys have already found, right? So like policy and budget, I encourage you, if you can, tune in with them tomorrow. Yes. Because I believe this was probably shared at the last CAB meeting. My apologies, I wasn't able to make it. But the Public Protections Committee, which is the standing committee of the Board of Supervisors, really wanted CAB to flesh out a little bit more of the priority areas around pre and post release engagement. So as you are looking into that more thoroughly, right, that could be a place where we could flesh out some more of these pilot options to ensure that connection points are made, right, from pre to post release. And obviously the women's services, I think that once those surveys go out for the women's module, again, we're gonna get information back that's gonna reaffirm some of the things that you guys were already kind of thinking about, and placing your attention toward, but then that data just kind of solidifies it. So, it's good that all of these kind of pieces will soon be coming together, and you'll find out that you guys were already on the right track.
So, I have a question before we talk about next steps.
Mhm.
You mentioned earlier about Jody, the in custody, the pre-release. Is it a way that we can have them present just so that we clearly understand as a whole what's being offered? Inside of there. So it's not really even about the agencies, it's just about the different classes. And I believe when, Jana did, present it and pass out the documents, I believe that that's when we were focusing on mental health. And so that's where a lot of the questions were going, because that was like over a year ago, but I remember because she had the pamphlet, but that was more about mental health and the resources we had and the need for them. But it would be nice to have that information shared with us, just so that we understand on a larger scale, whether it's an agency or not, we have these classes, these certifications that they can utilize while they're inside, would be helpful to me.
Yeah, I can certainly pose that to Jody and see what she's able to pull together. Yeah, let's see what she.
If they're not available, even if it's like a PDF, like these are the classes or the programs we offer, would be helpful, just to know, to have a better understanding.
Yeah, and I'm sure that there's different staff that are assigned to each of those programs that we can probably make contact with to get their individual, program materials or something like that to understand how their programs are being offered.
Any questions?
Like Janet.
Okay. You can come off mute, Jen. Okay, great.
Oh, hey, Patrice, my two presentations I did last year for pre and post release and employment, both together covers everything that Contra Costa Adult School offers. The first one I focused on employment stuff, and the second one I focused on the other stuff, so I wasn't repeating myself. But both of those combined does everything that Contra Costa Adult School provides inside the 3 county jails.
Thanks, Jana.
Would that be the same information you're asking Jody for, so would we need Jody, or should I just?
Well, that's just for the adult schools, so, if you wanted to know what AODS was doing inside, Independent Purpose is doing inside, I mean, what Detention Health is doing inside, there's so many other providers of a range of services that are offered in custody, so, she can kind of give the big overarching, overview, if you will. But Janet's just lifting up that if you wanted to know specifically what adult school.
And I'll go back and look at when she presented in her presentation. Focus on the adult school portion. Thank you. Kenny, if we could have you provide our next steps.
Sure. So what I have is for the in custody survey to update the narrative questions to be put in a multiple choice format. And then send those over to the sheriff's office to verify that they can input that into the survey. And then also have a requested timeline on a due date that we would like to have responses back by. And then for CBO presentations, review them and formulate questions to have a better understanding of what services are being provided by each CBO. And then the CBO site tour. I just have you guys had a site tour scheduled for Center Forest on the 25th, with Annette.
So I misunderstood the instructions last time, like, kind of like a meet and greet type of thing with,
Right.
with minimum and purpose and with, very legally, just like, introduce myself and, get handouts and stuff like that to get a, idea of what they do. I've known the minimum and purpose portion of my graduation, so. I think I've got it pretty clear, what they do and everything like that, but, if we do have, any further questions, I can either email them or go visit them and ask them.
Yeah, I think since you already visit with them, certainly you can email them and just with any follow-up questions.
I haven't met with one about 360 yet.
And then, did we mention that they're gonna update the questions 10 through 14?
Yes.
Okay, she said she was gonna send that to, yeah, but we would also need to look at it.
Okay, we'll get to you before we send it to sheriff.
Okay.
So for the next meeting, is there a certain, we just selected those because we figured, those three, we figured it would, not take up too much of your meeting time. To go through those three. If that process works for you, are there any specific, presentation? What's the next set of presentations you want to review like you did today?
We can do the last 4.
You all four?
Because as soon as we, I think it was in October or September of 2023. I think. So I can go look at it, otherwise, yeah, I think it was, and then I can look at it and then just start generating the questions, so we can just go through it.
Yeah, and we were trying to see, can't remember if Rubicon was able to come and do a presentation for you guys, but they did present during the employment priority area piece for policy and budget. And so we can at least include some of that information as part of the, your presentation review.
I think they did, because Rubicon was the one that needed the new computers. The digital computers.
That's the Success Center.
Oh, yeah, a lot, okay. But I do remember Rubicon, I do remember us having a conversation about Rubicon, about the resumes. Was it you? I remember.
I can't remember. I mean, we can dig again in our Gary and I, before she left, we were looking for the employment, to see if there was an employment presentation. I can't seem to find it. But, and we're thinking we can't find it, must mean they didn't get a chance to present last year. But nonetheless, they have presented just on a different purpose for, the employment, employment priority area. Nicole, you have, I'm sorry.
Yeah, so they didn't get to present for programs and services. They end up coming over to policy and budget. So there is a presentation from Rubicon with employment services within one of our work groups. That's where it ended up happening at.
Somebody remembered.
Yeah. And they gave a real thorough outline of all their employment services and stuff, which would be great to look at, because then it will help you with your questions. It'll give you some good questions.
What month it was?
March, it was the one that was mixed with behavioral health and employment.
For policy and budget.
Yep.
Yeah, it's gonna be more flexible.
We can locate and include it as part of the agenda package.
And I'll definitely say, look at those too, because even providers did include what they already gave you guys, but there may be some extra stuff in there.
Okay. So if there's no extra comments, that will conclude our meeting. And our next meeting is on Thursday, July 18th at 11 a.m. Thank you, everyone.
All right, thank you.
Thank
Thanks,
you. Have a good day. Bye.
Thank you.